Heart transplant is not a cure. What I mean by that is that getting a transplanted heart is not the same as getting a new version of the heart you were born with. There are common side effects and potential complications of heart transplant. You will need to be aware of these issues. First of all, you will need to take medications for the rest of your life. In fact, you'll be on about the same number of pills as you take now, just different medications. These medications are called immunosuppressants that are similar to chemotherapy. They are strong medications that sometimes can make you feel sick with nausea or diarrhea. Over time, immunosuppression medications put you at risk of getting infections and greatly increases the risk of cancer. Immunosuppression can lead to new or worsening of your diabetes and trouble with kidney function. About 1/3 of patients after heart transplant progress to kidney failure. Most importantly, if you miss your immunosuppression medication, your heart will go into rejection. This can cause you to die suddenly or develop heart failure again. With the heart transplant lifestyle sounding so rough, it's important to focus on the good news. People who undergo heart transplantation have a longer life and a better quality of life than living with heart failure. Slightly greater than 90% of patients will survive the first year, and half of the patients will live 12 years. In our clinics, we take care of some patients who had heart transplants over 20 years ago, and some have had multiple heart transplants. Our goal is to get you through transplant and then to grow old together. Getting a heart transplant is like joining an extended family. You'll be cared for by the nurse coordinators and heart transplant cardiologists for the rest of your life. The first year is the most intense, and people typically get stronger steadily during the first year after transplant. Initially, you'll be in the hospital between 2 weeks and 2 months. Then, after you leave the hospital, you'll need to be seen weekly at first and then monthly in clinic. The heart biopsy is a procedure similar to a right heart catheterization, and you will have many of these to look for heart rejection. You will not be allowed to be far from UC for the first year after transplant, but after that, you should be free to travel and lead a full life. We will test your blood for infections like HIV, hepatitis B, and C. It will be important that you are vaccinated against all possible infections, and we will test your immunity and give you the vaccines that you may need. This includes annual COVID and influenza vaccines. As you prepare for heart transplantation, make sure that you're up to date with your primary care physician. You'll need to have your routine health maintenance up to date, such as a pap smear, mammogram, colonoscopy, prostate exam, and dental. You will see an infectious disease specialist. They will review your blood tests and make recommendations on how to keep your heart healthy after heart transplant.